糖尿病 or the sweet urine. So, as you know, with our logo here, we can show some urine and a lot of ants coming. This is what the Chinese discovered. And they found out why suddenly patients get so weak, and then they found out that this their urine attracts a lot of ants. That's why they label as 糖尿病. Okay, but in English, we know the diabetes is due to the high sugar in the blood. Okay, and then when there's too much in the blood, the body cannot take it. The body have to excrete it. So they excrete through the urine. We know in the Western population, there are 3% of the Western population have this diabetes. And in statistics shows the whole world there are 200 million people having the diabetes. And this diabetes is a disease that has no cure. Once you are diabetic, you will be labeled diabetic for your whole life. And you have to either take medication or injection of insulin. And in Malaysia, we know there are nearly 1.2 million people in our Malaysian population having this disease known as diabetes. How do we diagnose diabetes? Before a doctor can label you as a diabetic, we have to do a blood test. The first one is the fasting blood sugar. So the fasting blood sugar means the overnight, when you sleep, after 10 o'clock, no food. Next morning, you go to the lab or the clinic, the doctor will take a urine sample and send for a blood test. And if the blood sugar shows more than 7.8 for 2 times, then you will be labeled as diabetes. Or another way is to take a blood test 2 hours. We call it 2-hour postprandial. 2 hours after you take your regular meal. So if the blood sugar after 2 hours is more than 11.1 millimole per liter, then also you will be labeled as diabetes. Why is this diabetes actually? How does the blood sugar high in our body? Normally when we take any sugar or carbohydrate, our body have this digestive enzyme will digest the carbohydrate. That's why you notice when you take potatoes, does the potatoes contain sugar? No. Potatoes is the carbohydrate. So when you take a potatoes, the body will convert the potatoes carbohydrate into sugar. That's why you feel, after taking the potatoes, put in your mouth, you feel it's become sweet. Okay? That is how the body can convert the carbohydrate into sugar. So once the sugar is taken into our stomach and then absorbed into the bloodstream, once they go into our bloodstream, our blood vessel, our body would sense it. Then they quickly send a message to the pancreas. Okay, the Chinese call qiu. It's like a ruler. Okay, pancreas is the organ that produces insulin, a hormone that will help the body to help the cells to use up the blood sugar. So what happens if your body or the pancreas is lazy? When the sugar in the blood is getting higher, and your body send a message to pancreas, but your pancreas to refuse to produce or become lazy, produce less insulin. Okay, so the insulin not enough to help the body to absorb all the sugar into the muscle for our activities, because sugar is used our body as energy. Okay, they convert into energy. And then if we have excess sugar, this sugar will be converted in the liver into carbohydrate. It will be converted again to carbohydrate as the storage. If it's too much again, the body cannot take it, they will convert into fat. Okay? If the sugar is so high, and sometimes the pancreas is not working at all, there's no insulin. So what happens to a patient? The body cannot use up the sugar. So we need to give the external injection of insulin. So actually there are simple 2 types of diabetes. We call it diabetic type 1 and type 2. Type 1 is the one that is dependent on insulin. That means the body, the pancreas is totally not working at all, not producing any insulin. Okay, so this is attributed to due to autoimmune problem. That means usually it is found in the young adult or children. That means they are from young. Somehow the body, autoimmune, the own body produce antibody to fight against the pancreatic cells. So once they fight the cell is being destroyed by the antibody, so the pancreas is out of function. So there's no way you can take any medication to help. So once you are labeled as a diabetes type 1, that means there's no hope to take any medication. You will be on a lifelong insulin injection. Okay, that is very simple. Number 2 is type 2 is non-insulin dependent. That means you still not depends on the insulin. Your body, your pancreas is producing deficiency. That means not enough insulin. That is because your pancreas is become lazy. So you need to take medicine to stimulate the pancreas to produce. So the medicine will go in and stimulate the pancreas. Hey, you need more. Wake up, produce more insulin so that you can help the body to use up the sugar. But there's another type that we found out, it's also under type 2. Patient can produce normal insulin, but the body cannot absorb because of the increasing fat. We call it fat resistant. Because of usually this type is found in an obese patient. When the patient is fat, a lot of fat that prevent the insulin from stimulating the cells to absorb the sugar. So what are the symptoms of the diabetes? As we know, a lot of people do not know that they have diabetes. Only when they are sick, they have a complication of diabetes. You know, sometimes they have a wound that is not healing. Then go to doctor and then only found out that, oh, actually this patient have very high blood sugar. Then only they are diagnosed diabetes. So a lot of time diabetic are asymptomatic. That's what nowadays we have a lot of people go for regular medical checkup. You go to hospital, take a blood test and see whether your blood sugar is normal or not. As I mentioned just now, fasting blood sugar not more than 7.8, okay? So some people, the symptom of this type 1 diabetes is because the body totally cannot produce insulin, so the sugar in the body cannot be used up by the body, and at the same time is the prolonged high sugar in the body actually cause a lot of harm to our body. It causes a problem with our nerve. We lost the sensation. It causes a blockage of the artery, the blood vessel. Okay? And when the blood sugar gets higher, our body need to excrete it. That's why the patient have we so-called 3P, polyuria. That means patient pass a lot of urine, polyuria. The other P is polydipsia, is thirsty. When you pass a lot of urine, you lose a lot of water at the same time. Because you want to get rid of the sugar, you pass urine, your body becomes dehydrated. So the patient will be very thirsty. And then sometimes they got very tired, they lose weight. Why? Because the sugar in the blood, they got a lot of sugar, but it's not used out of the body. The body cannot use the sugar because no insulin to help to absorb into the cells. Just like you have a lot of money, but you cannot use it. It's just inside your account, but you cannot touch. Okay? So this one, the patient will become very fatty because your cells can see the sugar but cannot use it. No insulin to help. Okay? This is type 1. Okay? So type 2, is that's why I mentioned patient deficiency in insulin. Okay, so and sometimes they usually don't know because this type the body cannot use it, so they have a chronic long-term high sugar in the body, and then eventually the complication sets in. After many years, 5 years, 10 years, your nerve all affected, there's no sensation, and if you have cut, you get infection, you don't realize. So a lot of people, diabetic patients, we always advise them to look at their food. Make sure they don't have any wound, because they don't have sensation. They lost the nerve function. So once they cut, they don't feel even the pain. So when they have a cut, they don't feel it, they don't treat it. And then once the infection, the bacteria go inside, then they got a very bad infection. Okay, then only they go to hospital and found out to have diabetes.